We'll start with breaking news out of Washington as we await remarks from the president, widely expected to be about GLP-1 pricing. Joining us this morning, Dr. Vin Gupta, NBC News medical analyst and Medat Health managing director. Doctor, it's good to have you back.
Good morning. Thanks for having me.
What do you know about the announcement, if anything, and does it sort of align with the reporting we've gotten about prices and the ability of some of Medicare, Medicaid to cover?
Well, Carl, there's some key details that we're still waiting on. Who will be eligible for this reduced pricing? What we're seeing and what's getting reported is that a month's supply of, say, Zepbound from Eli Lilly or Wegovy from Novo, or a weight loss indication will be as low as $149 a month, which, if that's true, is significant. I think this administration should be credited for continuing what the American people want, which is common sense policies to lower drug prices. Who's against that? I should note that that was initiated under the Biden administration with the Inflation Reduction Act. So they're continuing that policy. I know, folks like Chris Klomp, highly respected, leads Medicare. This is common sense. But we need to understand details here. Who is eligible for that, Carl? Are there going to be clinical criteria? Can anybody get it with minimal clinical oversight? So that's going to be important. I also think it's important to keep in mind that Eli Lilly and Novo Nordisk already do direct-to-consumer models where that $1,000 plus price point that the president likes to talk about is actually dramatically reduced for direct-to-consumer cash pay individuals here in the United States who want to utilize these drugs for weight loss indication. Is $349 on Lilly Direct. So we've already seen downward pricing pressure, but this is a great move if this continues here. Also, bipartisan continuation of common sense policies.
Yeah, 149 is pretty good, even though we're going with the range, as you said, maybe in the $300 to $500 a month range currently. Has your view of the total addressable market for these drugs evolved?
It's massive, for one, and I think what's really interesting here is there's an incentive. There's a reason why pharmaceutical companies willingly came to the table to negotiate with the government. Again, with the Biden administration, part of statutory law here. This is not executive order. This is statute to say, hey, listen, we need to finally negotiate with the government. The government has massive purchasing power, and they're now finally leveraging it. Both sides of the aisle are doing this. This is a good move for the American public. But think about Medicare, Carl. It's estimated at least 14 million beneficiaries on Medicare are obese, may not meet another covered indication for a weight loss drug, like, say, sleep apnea. Medicare already covers these drugs for sleep apnea, obesity, adjacent conditions, sleep apnea, elevated cardiovascular risk, you name it. But for weight loss alone, if you just say you're just obese and you don't have any other underlying conditions, it doesn't currently cover it. But 14 million beneficiaries suddenly might have covered access to this. That's a huge profit incentive for these pharmaceutical companies who currently do not get any reimbursements from Medicare for a weight loss indication.
I mean, so that's a huge deal in itself. There's also some reporting that maybe some of their obesity drugs will be able to be sold directly on the government's new direct-to-consumer website, Trump RX. What do you think is the significance of that? And how do you think it impacts, some of the economics here for these drug companies?
I ultimately think Novo, Lilly want access to the Medicare market, Sarah, and that's why, and they're also recognizing, as is every other pharmaceutical company, that the government has leverage, and they're finally utilizing it. Starting in 2024, we had the first 10 drugs as part of the Inflation Reduction Act. Now we're seeing continuation of that. It's a smart move, and we're going to see 10 drugs every year, so on and so forth. This is going to be continued. So that's smart. On the part of the pharmaceutical companies, they're recognizing even if they discount these medications for Medicare beneficiaries, they're still going to profit enormously. So it's a win-win. It's a win for the American public, and they're still going to have a gigantic profit center here with the 14 million beneficiaries.
Why don't a lot of the employer insurance plans and Medicare cover these obesity drugs for obesity?
Well, if you're a self-insured employer, Sarah, the problem here is, will you actually retain the benefits of that employee's better health over the fullness of time? And that's the concern here. If they cover something right now, and right now it's at a high rate, will that employee be retained? Will they stay at that company, and will that company then accrue the benefits over time of a healthier individual? Chris Klomp was at a conference, the director of Medicare, yesterday, citing that on average, we're going to save about $6,000 per Medicare beneficiary over time that receives covered access for a short period of time to these medications. He's right that there is over the fullness of time here, people have better health and they're going to cost the system less money because they're going to be out of the hospital, have less underlying conditions. But right now, the self-insured market, the employer market says it's too expensive and we have no guarantee that we're going to actually benefit from the improved health of our employees. So it's a dollars and cents decision.
We're awaiting the president's remarks. Of course, we'll bring them to viewers as soon as they happen. Dr. G, it's always good to get your help. Thank you. Vin Gupta.
Thank you.
Let's get to the outlook for the